start with the patient. So like I said before, last week, you're gonna open this. Even though this is sterile, we can touch the outside of it. And I'm gonna just leave it in the packaging. I'm gonna open this package and take it out. It's wrapped in a sterile little pouch, so you wanna keep that clean and closed. You see how it's a little triangle thing? That's the first one's going to open away from you. So you're gonna put this facing this way to you. I don't know, whatever you wanna say, the V facing you. I'm gonna open my gloves and try not to touch it at all. Opening the sides this way. And making sure it doesn't fold back on itself and no one's touching it. Another thing I should have mentioned last week is when you have your sterile tray or field ready, you never want to have your back to it. You always want to face it, so you're always watching it, so you know someone didn't accidentally bump into it, like a student or some nervous med student or whatever. Now opening this part, I'm going to grab this, open it away from me, and then the sides go to the left and right, and then the last thing you're going to do is pull towards you, and now you're opening the gown itself. The reason why you want the first pouch is going to be away from you is because it will still cover, so you want to go away from you. If you did it the opposite, where you're now this way, now my hand's over the sterile gown, so you would break sterile field. So at the very end, you're pulling towards you, and now it's all brand new and open. You're doing hand hygiene. If you're in OR, you're gonna scrub your hands. There's a sterile towel here where you would use to dry your hands off and throw this one away. Now I'm gonna grab the gown. Try not to touch all over it, but you're still gonna touch this is gonna be the inside of the gown. You see how there's like a smiley face here type of thing, and there's these little pouches for your hands. The smiley face is facing you, so your hands go in the inside of these little pouches on the sides. You're going to step away from any table, have an open area. As you put your hands in it, you're going to open the gown and shimmy your way in. And making sure your hands don't come out of the white cuffs. Okay, staying inside. Now I'm gonna need a second person to help me tie off the bag.
Okay.
So there's Velcro around my neck. You're gonna put that Velcro on.
Now I'll touch this part.
Yeah. And this might be a little too small for me. And then there's the string inside on this side.
I have a string.
And then there's one on this side as well.
It's on
From the inside.
inside of
On
it.
the inside?
Say pause first.
We're gonna put another one.
Okay.
Okay.
Good.
Got it?
Tie it off?
Yeah, you can tie that. Okay. Okay. So now I'm gonna put my. We're gonna pretend that didn't happen. Don't look. Okay, my hands are still inside, so now I'm gonna do my gloves. So this is a difficult part with the gloves because you can't have your fingers come out of the white cuff. If it comes off, you're breaking sterile field, you're gonna start over. So I'm gonna grab the gloves using the gown as much as I can like this. So I'm gonna do my right side first. And I'm gonna try to slide my hand in without it coming out of the white part as much as possible. Once my fingers are inside, then I can pull it out of the white cuff. So now they can come out, okay? If in the first case, you can take forever doing this part. So if your fingers come out all weird and it doesn't go in your thumb like mine is right now, then you're going to have a, so like this, then I'm gonna let go. Now I'm gonna switch hands to the other side. Going inside. Now I can use my sterile glove a little bit better. The second one's usually easier to put on because your hand is sterile and you can fix yourself now. And this is where The white cuff still on your like hand part. Don't have it too far up because you don't want it to slide up when you're doing the procedure. And this gown is a little bit small on me, so if I pull my arms a lot, it's gonna come out. So we leave it up, as high as we can, just so we prevent it from sliding down. Because if the gown comes out of the glove, then you're gonna break sterile field. The last part is tying off the gown itself. So now this is where I need my second person. I'm going to rip one side off. This side I need off. I'm gonna rip this side. You see there's a blue and a white part. The blue is the sterile part I'm going to touch. The white piece is what I'm gonna give my helper. So you're gonna grab onto the white piece. You're gonna go around me. I'm gonna grab the string. He's gonna hold onto the paper and pull it off. And he can walk away. Now I can finish tying myself off. And now you're fully complete to start. So at this point, remember last week I showed you guys using your elbow to throw things off out of the way. But at this point I'm already sterile. Technically the inside of this is sterile, so you can't touch it, nothing else has touched it. But in real life it's a lot easier to ask someone to pick it up for you and throw it away, if that's going to be around where your sterile field is going to be. Questions? Yeah.
What if you're in the middle of doing an art line and somehow your supplies gets contaminated in the middle of it? You have to start all over again and gown up all over again?
What's contaminated? Like,
Let's say a
just the
nasty nurse
supplies?
came in and she's like, didn't wear a mask and she coughed.
Then in that case, yeah, the whole thing would be.
Okay, as well as you.
Yeah.
Okay.
If it was a coughing situation where they coughed all over where you are. But sometimes like a needle falls off or something falls onto the tray, you can just change the tray, but you don't have to change your gown. But then you would have to stay like this and have someone open it in a sterile way for you to reuse it then.
What if it was a patient? And they like, same. I'm waking up. Okay.
Best situation is when the patient's sedated and asleep. That's the easiest one. If they're awake, you will put a surgical mask on them. Tape their arm down so they're not moving. And in real life, you're going to hear the words of the patient's on antibiotics anyway. That's the sad, that's the sad truth. Yeah, but at this point, I have my mask and my bouffant cap on as well. People in the room, the nurses and everyone else, they should minimum have a mask and a bouffant cap as well. And if you're walking as a student, for you guys as well, if you're in the room with the procedure, always walk walk around the sterile parts carefully, because we've had students get kicked out of OR and procedures because they broke sterile field on accident. Good. I'm gonna show you, like, if I were to put the gloves on and I missed it the first time, when you have like your weird claws inside. I'm gonna show you what to do and what not to do. So let's say I was doing my very first one, I grab it like this, and I put my fingers in. Let's say I somehow mix the finger holes and I have weird claws like this, where my fingers aren't in it properly. You can't readjust, you can't fix too much because of the risk of having your hand come out of the cuff. So you're gonna have to work with whatever you have. I'm gonna try to put the other one on as best as I can. And then afterwards I can fix all my fingers because both my gloves will be. So now I have this good, and now I can use this hand to touch the fingertips now and be able to slide as fast as I can and then fix the rest. So if you have weird claws in there, you're gonna have to work with what you got. You only get one chance. But you can't take them out and retry. Okay. Okay. So I have all the supplies here. I just forgot